Please stand by. We're about to begin. Good day and welcome to the American Lung Association StayWell Freedom from Smoking Plus, the Right Choice for a Smoke-Free Life conference call. Today's conference is being recorded. At this time, I'd like to turn the conference over to Mr. John Evers. Please go ahead.
Hey, everybody. Thank you so much for joining us today. I'm really excited you could make time in your day to fit this in. My name is John Evers. I'm from StayWell. I'm the Vice President of Health Association Partners. StayWell is very lucky to actually have great relationships with several leading health associations, including the American Lung Association. And that's why we're so happy today that you were able to join us, because we've partnered with the Lung Association to work on a really great online program, Freedom from Smoking Plus, that we think is fantastic, and we think you're going to think is fantastic as well. So we really are excited that you're here today to learn more about that program and how it might help your employees. So moving in, let's talk a little bit about that. Our relationship with the American Lung Association has been, I think it's about 10 years now. And we were very excited to partner with the Lung Association to take their 40-year-old program, which is a super successful program for smoking cessation. And many of you may have heard of Freedom from Smoking already. And about a year and a half ago or 2 years ago, the Lung Association said, hey, we'd love to work with you, StayWell, on developing a program that will bring freedom from smoking to folks who want to use it on a computer or a tablet or their smartphones, which is how many people are learning these days. And you know, StayWell believes that too. That's one of the nice things that the Lung Association and StayWell have in common, is that we are always looking at how are people learning and addressing those needs accordingly. So whether you're a print learner, we have things in print, and if you are a computer learner, or an e-learning person, we have that for you as well. But what's really great about this program is that it's all based on proven behavior change methodology, and it takes all of that information and it puts it out to the participant in a really engaging way that is kind of fun to use. I mean, quitting smoking is not fun, of course, but you know, if you can make it a more palatable experience that's engaging and really helps people through the tough spots of the challenge of quitting smoking, then that's fantastic. You know, everyone needs help when they're quitting smoking, and I'm happy to tell you that this course integrates a very extensive support network, including the American Lung Association's Lung Helpline. And I really want to pause here for a second to tell you about the Lung Helpline, because it's not just someone answering the phone who maybe just is you know, a regular customer service person. When you call the Lung Helpline, you will be assisted by a nurse or a respiratory therapist who's been specifically trained in smoking cessation. So I always kind of think they're the real deal. Like, if you really need help, that's the person who's going to help you the most. So we really took what StayWell brings to the table here is our experience in e-learning and instructional design and user experience, and worked very closely with the Lung Association to bring this out on this very solid foundation of a program. And so, you know, when I think about our association partnerships, I always think of the Lung Association as one of those who aligns really nicely with StayWell's behavior change beliefs. And so this course, I'm happy to say, is built on the stages of change model. And that's something that StayWell also practices as well in our own behavior change program. So it's a nice fit for both of us. And the proof is sort of in the pudding of this program and that whole model, because it has helped over 1 million Americans quit smoking over the past 40 years, the clinic version, and you know, has a very good quit rate, really great quit rate, the clinic version of about 60%, a little less than 60%. So all of that great background, what do we do with it? You know, how do we carry that forth into this digital experience? And so that's what we've done now. We're going to share that with you shortly, and I think you'll really enjoy learning about it. And I do want to hand off in a moment to our great friend at the American Lung Association, Jennifer Falkenroth. She is the Lung Association's National Senior Director of Tobacco Programs. And, you know, when I say the Lung Helpline is the real deal, well, Jen is the real deal too. She has been at this since 2004. She started her career as a tobacco treatment specialist, and she has certification from the Mayo Clinic, which she received in December of 2006. Over the past 14 years, she has been a real in the trenches of the Lung Association and also of Freedom from Smoking, and she is helped deliver this program to over 1,000 tobacco users and she's helped over 1,000 of those folks quit their lifelong addiction. And now she's in a role where she is responsible for all of the Lung Association's health education programs, activities, and messages related to tobacco prevention and cessation. Prior to joining the Lung Association, she was employed in the healthcare system providing nicotine addiction and tobacco treatment counseling in clinical and community-based settings. So that may sound familiar to some of you today. She's very, very passionate about developing and implementing and enhancing the delivery of programs that, at the end of the day, will really help somebody quit smoking, become tobacco-free for life in those communities where it's needed most. So with that, I am going to stop talking, and I'm going to hand it over to Jennifer, who is really going to be able to dive deep in and really highlight all the great things about the Lung Association and this program. So enjoy. Thank you.
Thank you so much, John. Hi, everyone. It's great to meet you. I'm very excited to be connected with you all today to talk a little bit more about the American Lung Association, but most of all, the Freedom from Smoking program and how it can really help support your community members, your employees, the folks that you're looking to serve and break free from the addiction to nicotine. So American Lung Association, I'm sure not a new agency to your ears. We were founded in 1904 and first started our tobacco control work in 1963. Over the last 40 years, we've helped over 1 million smokers successfully quit. We are a huge supporter of smoke-free air laws, and one of our passions is really working to improve tobacco cessation coverage, making sure that we are breaking down any barriers associated with individuals getting the help they need to live tobacco-free lives. As you know, though, tobacco is not our only bag. We have lots of programs that we focus on out in the community in terms of just general lung health, including asthma, lung cancer, COPD, other lung diseases, and of course, clean indoor air as well as outdoor air. So really making sure that all of us are entitled to breathing in clean air, which all humans deserve. So a little bit about American Lung Association's core beliefs when it comes to tobacco cessation and helping people quit. If there's one thing we know, it is that everyone can quit. There may be doubts out there among individuals in saying, I've tried this, I've tried that, nothing has worked. I can guarantee there's something else that can be done, a program that they haven't tried yet that will be successful. Also, you don't have to quit alone. You know, in my years of tobacco cessation programming, one of the scariest things about quitting is loneliness, and tobacco users really identifying with their friends, their coworkers, their family members who are still continuing to smoke while they try to quit. No one has to quit alone. There is so much support and different, mechanisms out there, including behavioral counseling, and also quitting along with others, going through the same, challenge that you are. Also, learning how to smoke and learning how to quit. As an ex-smoker myself, and I'm very open about that because I'm one of the very fortunate individuals out there that has a profession that feeds my passion each and every day. As an ex-smoker, I can say that I never realized that the quitting process really came down to me learning how life was without that cigarette in my hand. So, you learned how to smoke, now you have to learn how to quit. You have to learn how to revert your body back to that natural state of being tobacco-free. And that is absolutely a process. And also we know that it takes smokers several quit attempts before they're able to do it for good. The most recent studies from CDC show an average of 8 to 11 quit attempts before an individual successfully quits for good. Now, I can tell you, in my tenure, I've had individuals come to me as first-time quitters that have been extremely successful, and others who are pro-quitters who say, I'm a professional quitter. I've done it so many times I can't even tell you my number. The fact of the matter is, many times the inability to successfully quit had nothing to do with the individual's desire, their importance, their confidence level. It really came down to the program that was in place, or even the timing wasn't right. So with the right program in place, the right support, the right medication, the right formula, every single individual can break free. And one size doesn't fit all. So, we obviously support behavioral counseling in addition to medication. So, between counseling and the 7 FDA-approved medications that are available for tobacco cessation, the combination of those two increase an individual's chance of success. However, there are so many different combinations between those. So really going through that self-discovery to see what would be the best for that individual. This is an interesting study I would love to share with each of you. Berman Crame's Smoking Employee Cost Study. So this was conducted, and through the study they estimated that the annual excess cost to employ a smoker in 1 year's time is $5,816. And you can see here a breakdown of how they came up with that number, but just a very interesting study, and really shows the huge benefit that companies can have by offering a tobacco cessation program directly to their employees to really support them in being successful and breaking free. A lot of money could be going back into your pockets just by offering a simple program to get them on their journeys. Freedom from smoking. So this has been my baby since 2004. Love everything about freedom from smoking. Let me talk a little bit about the philosophy. So the thing I love about freedom from smoking is it truly empowers the individual. If there's anything we've realized, it's the facilitator, the leader, the program works. However, you really got to work the program. It all comes down to the individual being the expert, So empowering them to go through self-discovery, identifying their smoking patterns and routines, and really helping to establish an individualized quit plan that they know will work for them. We also have this as a voluntary program. So although I have had folks come in through our programs that were, forced to go into the program either to receive a surgery or maybe a nagging spouse at home that, they were just tired of getting nagged, and they said, okay, I'm here for her, I'm not here for myself. But we really do set a basis for this to be a voluntary program. Extremely interactive, so it's more of a support group kind of feeling. We really want give and take. This is not the lecture. This isn't an opportunity to teach and preach. It's all about self-discovery and individualized plans. Supportive. So freedom from smoking always bases not only the curriculum on the quit attempt, but also making sure there is ample support for that individual going through all transitions of their quit attempt. Positivity. As an ex-smoker, I can say there's a lot of negativity and stigma that surrounds individuals who are tobacco users. And one place they should never feel that is a place they're coming for help and support. So freedom from smoking is based around extreme positivity and just really giving them that cheerleader that they need to be successful in their climb. Addiction-based model and behavior change focus. So one thing about freedom from smoking is we truly follow the addiction-based model. So smoking isn't just a bad habit. It is a serious addiction. And so freedom from smoking really helps to break that chain and get individuals to be free. And then support from use of FDA-approved medications. So research does prove that with using medication, one of the 7 first-line medications approved by FDA for tobacco cessation, in tandem with a program, an individual can increase their chances of success up to 50%. So we really do encourage individuals to take a look at those medications and explore an option that may be best to support their attempt. We also have a strong foundation in proven behavior change theory. So one of the first principles is the Transtheoretical Model. Now this is all about stages of change. Where are people at? Are they even thinking about quitting? Are they preparing to quit? Have they quit before and have relapsed and now are trying to get back on, back on board with being tobacco-free? Social cognitive theory. So this really all comes down to making sure that they are mindful about, their choices. They're really building their skills and confidence in quitting, and they're working out the consequences to the choices they make and really reinforcing those positive choices and positive behaviors with rewards. Motivational interviewing. So if you're ever looking for a fun leisure course to take that's just interesting, I would highly encourage you to look more into motivational interviewing. It really is a great back and forth. It even works with spouses. So motivational interviewing can really have a great effect on working with an individual and helping to prompt them through the discovery of developing their own plan and really allowing them to be the expert in making that decision. It's definitely a two-way discussion. The grief cycle. So this is one that a lot of people are surprised about when they get into freedom from smoking. They say, what does the grief cycle have to do with quitting smoking? There are serious linkages between ending an addiction and quitting smoking or tobacco use and going through the 5 stages of grief, the same stages you would go through with the passing of a loved one. So we definitely want to recognize that, and we want to let individuals know that this is a process. And so the way you're feeling is not because of you, it's because we are currently in this cycle, but there is hope that we're getting to that next piece of the process very soon. So really making sure that behavior change theory is a strong foundation and component to freedom from smoking. So let's talk briefly about that stages of change. So as you know, change is a process. So individuals will start all the way down here at pre-contemplative. So, they're not really thinking about quitting. They are tobacco users. It's a part of their life. They justify it. They feel good about it. This is just them. Then there's that one little, part of them that starts contemplating the idea of what it would be like to be tobacco-free. What would that look like? Really kind of kicking around the idea of quitting. And then, of course, preparation. So these are individuals who are now starting to consider, how would I quit? What kind of plan could I have in place? Action, of course, moving forward with setting that quit date, quitting, and trying to maintain that tobacco-free lifestyle, which moves you into the maintenance phase, and eventually termination, where you no longer have to worry about, returning to that cigarette. So here's just the formal name versus the simple name, but just to let you know, freedom from smoking really bases itself on those that are in the preparation phase, so those that are ready to quit, all the way down through to termination. We can certainly talk to those individuals who are pre-contemplative or contemplative, but really the Freedom from Smoking program is for those who are ready to do this. So what is the program all about? It is highly structured course of the program, and again, focuses on that behavior change. The thing I really love about freedom from smoking is we aren't collecting cigarette packs at session 1, okay? I think one of the biggest concerns I've had with patients over the years, they come into me for the first session and expect that I'm gonna, be the big bad wolf stealing their cigarettes or their can of chew from them and say, okay, here you go, let's start this new life. No, that's not how we do it at all. So we spend ample time on really preparing ahead for that quit date. So the first half of the program is really preparation, identifying smoking patterns and routines, identifying stressors that we really need to plan ahead for, those high-risk situations, and really developing that quit plan so that when they are ready for that quit day, they have all the tools they need in that backpack to make the climb to the top. And then the second half of the program really is all about supporting that new tobacco-free lifestyle. So how do we maintain it? Again, I can tell you as an ex-smoker, quitting smoking is the toughest thing I've ever had to do in my life. But without a doubt, maintaining it every single day and staying smoke-free after you know what that experience is like and just how tough the addiction truly is, that maintenance is almost harder than the quit itself. So we really do spend a lot of time on supporting an individual in maintaining that new lifestyle and planning ahead for potentially some unforeseen triggers that may occur. Focusing on the maintenance after quitting is a huge strength of this program because, in fact, this lays the basis for the rest of their life. Here are just some major concepts and key elements to the Freedom from Smoking program. You can see we really do cover a wide variety, not only of typical aspects of tobacco users, but also addressing many of the fears and concerns that have been presented. You know, a lot of tobacco users worry about weight gain after quitting, and so we, make sure to address, ample content on them maintaining their current weight or even reducing. Coping skills, this was always my best friend. It was my stress reliever. What do I do now? So let's give them the tools they need to be successful in coping with that stress. Assertive communication, really being able to relay, not feel guilty, but also not feel aggressive after quitting as well. Just keeping motivated, recovering from that sense of grief, building a new network of social support, and really learning to monitor yourself internally. The voice in our head is the loudest one we'll ever hear, right? Because we are the ones that ultimately make the decision to go forward with something or not. So really being able to catch that sense. So Freedom from Smoking is available in 4 different delivery options. It can be offered in-person group cessation clinic, face-to-face, typically in smaller groups up to 16 people. Freedom from Smoking Plus, which is our newest platform, the online, which I will be going through further in depth in today's conversation. The Lung Helpline, where we can do telephonic counseling, as John said earlier, with our staffed respiratory therapists, registered nurses that are trained and certified in tobacco cessation. And then, of course, we do have a self-help guide as well. Those that are AFRIC, you can see, are available in Spanish. And just to let you know, the Lung Helpline is available in over 250 different languages. So let's talk a little bit more about that Lung Helpline. So we'll go into each of these options just to give you a little bit more background. So as John said in the beginning, this is staffed by nurses, respiratory therapists, and trained tobacco treatment specialists. It is open 8 a.m. to 10 p.m. Eastern Time, and on the weekends as well. So there's not a single day that it's closed. So that's nice. And if for any reason individuals call after hours, that call is returned within the first 24 hours after receiving that message. So we never let them hang in. In addition to tobacco cessation, we really are available for any other lung health topic as well. So if you're concerned with, lung cancer, you want to know more about, increasing your lung function for COPD, helping to reduce your asthma triggers or how to manage your asthma, air quality, anything related to lung health, we are there to help support. So 1-800-LUNG-USA is always available. It's a great service, and I highly recommend that you take advantage of it. Freedom from Smoking Plus. So this is the one I'm really excited to talk to you about today. American Lung Association's Freedom from Smoking Plus, I have seen tremendous growth in the popularity of this platform specifically over the past year and a half. So Freedom from Smoking Plus, I've found in my workings in the community, has been a perfect fit for community members, patients, multi-unit housing residents, corporations, wellness programs, schools, colleges and universities. The reason it's shown such tremendous growth is that it provides a comprehensive program, addresses today's mobile lifestyles. I mean, how many of us walk around with our cell phone in our hand or at least always know where that cell phone's at? or feel crazy when we can't find it, if, like me at home with my 2 kids that tend to walk off with it and then I don't know where it is. But we always have our smartphones with us, so it really addresses today's mobile lifestyles. It provides flexibility, so it can be done anywhere at any time. So if I'm taking my break at lunch and I don't want to go outside and have a cigarette with my colleagues because I'm on my journey to freedom, I can just pull out my phone and hop into a session and start working through. I can also do it in the evenings after I put the kids to bed. Unfortunately, an evening program wouldn't work for me because I have to go home and cook for the family and get the kids to bed. But that time after the kids are in bed and I can finally breathe, that's the time I would pull out my cell phone. So it's so flexible to really accommodate any schedule. It ensures privacy. It helps to track progress, so I can watch my progress as I go, which is so rewarding, and really provides, an opportunity to feel complete. As you go through those courses and you finish the activities, it also provides a certificate of completion at the end, so just a nice rewarding thing. So let's take a peek at some of these features. So the Freedom from Smoking Plus platform has 9 different sessions. The first 4 sessions is part 1, getting ready. So this section is all about preparing ahead for that quit attempt. So really navigating those roadblocks, exploring your addiction, and breaking down your smoking patterns and routines. And then gaining control back. What system can I have in place to not smoke that cigarette? And then making a comprehensive plan. The thing I love about it too is it's tailored to me. It's not a one-stop shop. So I am the one investing in building my own quit plan that I know is going to work for me specifically, no one else. Part 2 is taking action. So this is the action phase, as we talked about in the stages of change, the quit day. Now the individual can set their quit day, and I'll be showing you that, but they can set their quit day for whatever day they feel they want it to be. So once we hit this quit day, we have everything you need to implement that plan that you've been working on building over the last 4 sessions. And then part 3 is all about staying smoke-free. So the last 4 sessions of this program are all about maintaining that tobacco-free lifestyle and addressing any fears or concerns with truly embracing this new life. Let's take a look at the landing platform. So this is the dashboard. This is the landing platform. So if you go to www.freedomfromsmoking.org, this is the page you're going to see. The thing I really love about this is sometimes individuals aren't sure if they're quite ready to dive in and start a program. And you, as a company, you don't want to give them a membership to quit if you know they're not quite ready to really work that program. So what's great is you can navigate your staff, your community members, your partners directly to this website where they can really explore if they're still deciding. So you can see the block in the bottom right corner, I'm still deciding. I'm going to use my little handy. Let's see. Oh, look at that. Hopefully you can see that arrow. So the I'm still deciding box is right here. They can click on that and learn a little bit more about their reasons for quitting. There is a quiz on there that kind of prompts to walk them through to see if it is their time to quit. So this is just a really nice added feature that you're not giving out memberships for this program to individuals who aren't quite there yet. Of course, and I'm ready to sign up. This is for folks that are ready to dive into the course. You can see we do have different sections up here we'll be going through, and then, of course, joining now and logging in if they've already signed up. So this is the first site that you'll see. Once you get in, once you register for the course, so let's say I'm one of your employees now and you gave me one of your memberships that you purchased for this program, and I now want to start my journey. So I'm going to go in here and I am going to select my quit day. So it can be any time that works for me. Maybe it happens to be the day after my birthday, maybe there's a significant date, or maybe it's just a date that I know I'm going to have a couple days under my belt before I'm strapped at home with the kids over an entire weekend with them driving me crazy, right? So you can choose any quit day you want. Once you select that quit day, you will see that it will count down how many days until that quit day occurs. So it really helps to gauge you, give you the cognitive ability to prepare yourself mentally for that day. This is inside. So once I get in, I'm going to go to the first section. This is what one of the courses would look like. So in part 1, getting ready, you can see there are different sessions. There's the first 4 sessions associated in that getting ready and preparing for the quit attempt. I wanted to show you some of the tracking associated with this. So one thing that's great about this is FFS Plus users can always monitor their progress at all times. So you can see this individual started part 1 in the getting ready, but they haven't yet gotten into their session 3 or session 4 as it's 0% complete. So they can go in here at any time and start diving into developing their quit plan, coming up with a reward system for their quit day, taking the quiz, learning about lifestyle changes, the session 3 quiz. So they can always just track their progress and understand exactly where they are. Here in the Pack Track, so this is a great example of one of the interactive activities in helping them to tailor their quit plan to their current smoking patterns and routines. So with the Pack Tracks activity, they will log each cigarette that they smoke. And then it aggregates the data and really shows it to them in a cool little graphic so that they can really get a better understanding on where, when, and why they smoke. And a lot of times, you know, as smokers, we go on autopilot. You know, we don't realize how much we smoke or where we smoke, or that every time we're stressed we're lighting that cigarette. Or, man, I really smoke a lot in the mornings on that commute to work. This is one of those great activities that makes it all about me and making it really mindful of the style of user that I am. Freedom from Smoking is also designed to be highly interactive and engaging. So if someone wants to earn a certificate of completion, they will be required to complete a certain number of activities and quizzes throughout all 9 sessions of this program. So just letting you know, Freedom from Smoking Plus is recognized as a reasonable alternative standard under the Affordable Care Act. We definitely value the process that they go through in order to receive that certificate. The certificate of completion at the end upholds that they have gone through each and every session. They've gone through all of the activities. They've gone through all of our evidence-based models to really give them what they need to be successful. So this shows an individual's dashboard. They've completed the reasons for quitting. So you can see the done flag. So they've already done session 1's activities that are required. They've done their medication plan. They've completed this one. But they still need to do the making lifestyle changes in session 3. So you can see this has a red required flag. They are not able to get their certificate of completion at the end until they complete this session and that banner turns green that they have successfully done it. It also lets them know how many more they have until they can complete the program. So they're always in the know of their progress of completion. Moving on, this is another great one. So this screen is showing you one of the ways Freedom from Smoking Plus is designed to keep users engaged and interested. So these roadblocks to quitting are presented as flashcards. And when you click on the flashcard, it flips over to give more information. The thing I really love about this, too, is I'm not being drowned with information. I'm only clicking on those flashcards that are really relevant to me as a tobacco user. So, you know, if weight gain is something I'm really concerned about, I'm going to click on this flashcard and learn a little bit more about navigating that roadblock to keeping that is in place, keeping me from being successful. So really just, again, interactive, but yet tailored to me. So let's go ahead and take a look at some of the other main links that are available once an individual goes into their dashboard. So as you can see, here's the dashboard link. Anytime they want to click back on that to watch their progress through any of the sections, they can click at any time. Getting ready, of course, as we talked about, is part 1, sessions 1 through 4. Taking action, session 4. and 5 through 9, staying smoke-free. So these are really great as well because I can go back and forth. So let's say I've already quit and now I'm in session 7 in staying smoke-free. But there was something that I learned in session 2 that really has resonated with me. And I want to go back and revisit it because I think it's really going to help me get through this roadblock or this, urge that I keep experiencing on the weekends. I can go back at any time to explore any of these sections, which is just really cool. Also, community. So I have instant access to the community button that takes me to the Inspire platform where other individuals are currently quitting as well. So I can share my urges, I can share my struggles, I can even, boast about my successes. And then, of course, the Lung Helpline button, which we'll talk a little bit about later, but they, again, can have instant access to our telephonic counselors, at any time to really talk through any questions they may have or get further clarification. Moving down to this next bar, each session starts with an overview, so they know exactly what they're about to learn in this session, and then subsequent different sections of that session. So each of the parts comes in 3 different phases and will really provide them an overview of what each of these sessions holds, so just so they can feel more prepared. Bringing it all together. So at the very end of every session, they've completed their quizzes, they've completed the activity, they now have the tools in their backpack ready for the climb for session 1. At the very end, it always brings it all together. So what am I leaving with after this session? I now know my reasons for quitting. I know that they will outweigh any experiences that I have that may feel negative will outweigh the short-term discomfort. So we really are going to stay motivated. We're going to focus on the positive and the benefits. I know that I always have that Lung Helpline that I can contact at any time, or the Inspire community where I can talk with others quitting as well. And then when I come back to session 2, this is really going to help me build my momentum in quitting and steps given. So now I know what's in store for me in session 2. So just a great way to bring it all together at the end of every session to have that kind of lessons learned recapped. So now we're going to talk a little bit about that resource section. So this section is great. It really gives extra added tools to an individual for what I like to call that backpack for their climb up the mountain to freedom, right? So this will have downloadable relaxation exercises that they can use for stress management, different tools to really help them in staying smoke-free, tons of different resources that they can really tailor and enhance the program in itself to stay on track. Another part of the resource section, so you can just see many different tips. So a lot of the frequently asked questions, are here. A lot of those really great resources that are sprinkled throughout the entire course of 9 sessions are at instant access in the resource section at any time. So let's say, I'm in session 7, but I'm really thinking, man, what was that list of healthy snacks that they gave me in session 4? I can then go into my resource section and I can pop that up at any time. Or maybe that medication chart to really, explore what the other options may be. Or those pack tracks to go back to my, smoking patterns and routines. So again, just a great resource to have instant access to all of the goodies that are offered throughout the 9-session course. So let's talk a little bit about Freedom from Smoking Plus and how it works with corporate accounts. So what I love about this is it is the easiest program that can possibly be implemented. And I know our demographic today, corporate, HR, individuals really working to serve your employee population. One thing that I love about this is it's a one-stop shop. It's super simple to administer. You basically say how many memberships you think you are going to use in the next 2-year period of time. We will then set up a dashboard that you can help track the progress and you can track those memberships. So it'll always show you the number of memberships that you have available. It will also show you who has registered for the course. So you will have a unique URL that you can give out that's specific to your block of memberships. Once you give that employee that URL and they click on it, they're prompted to go ahead and register for their own course. So they can go ahead and register. You will get immediate progress update that that individual has registered and that membership is now in use. You will also get progress notes on those who have completed it. So you can go into your dashboard at any time to see what % of the program they've completed or if they have successfully completed. And this is really great too, because if you have any incentives for employees that go through a program successfully, whether it be, addressing, their premiums, or maybe you have wellness points that provide through a specific program at your organization, not only can they bring you the certificate of completion that's provided by this program's platform, but you can cross-reference and check it on your own administrative dashboard to see, yes, Jane Doe has completed 100%. This certificate, is valid. So it's just nice to have a cross-reference for checking. Downloading a report. So another great thing about your dashboard is after you buy that block of memberships and you start handing them out, let's say the higher-ups come to you and say, what's the outcome on that program in real time? How's it going? And you think, oh no, I got to pull these numbers together before that 2 o'clock meeting with my boss. What's great? It takes 2 seconds to download this report. So you just go into your link, go into your dashboard, export. It's going to provide you with the name, email address, the registration date, what date they set to quit, so you can even be on target with knowing when folks are planning to quit. When did they log in last? This is also great too, because if you see it's been dormant for a week or 2, it gives you an opportunity to reach out to that staffer and just kind of re-engage them or remind them that you're there to support them if you wish. And then, of course, completion status. So you could then go and say, yeah, of the 35 employees that are currently enrolled in the program, 16 have successfully completed, 8 are halfway through, and 2 are in the first section. So that's just a really cool evaluation system that's always in place and available to you. And this is what it looks like. So this is a sample of the corporate dashboard. So you can see the name of your organization would be up here, the number of licenses you purchased in the block. Again, you're given this URL code, so you can even turn this into a condensed like bit.ly, just a short little version that has your company's name in it, that any person in your company that clicks on that link goes straight to your dashboard. Once they do, they'll go ahead and register for the course, and it will show how many individuals have used one of your memberships. So you can see of the 20 blocks that this corporation has purchased, 4 individuals have retrieved one of those memberships. 16 are still sitting there ready to be provided to one of your employees at any time. So again, this is just the URL that you provide. This is unique to your company block. So anyone that is not provided with this URL has no access to your memberships. This is for you and you alone. And then just information about your purchase and when this whole membership block kicked off. Again, this shows the list, so this is what, at any time I could go in here, I could see what staffer is using which membership. I can assign employee ID if appropriate, their email address, when did they last log in, and how far are they through completing the program. So again, there's an export button that you can click and easily export this into an Excel spreadsheet and be ready to share in real time. So the length of the membership. So each Freedom from Smoking Plus membership is good for 1 full year. And it begins the day the individual activates their membership. Why do I love that so much? Well, the reason I love the full year of support is, when you're going through your journey, it's one thing to quit, but then again to maintain. A lot of times with the in-person program, after you complete that program, you're kind of on your own to go out there. This provides 12 full months of continuous support to help maintain that tobacco-free lifestyle, to always have instant access to the telephonic counselors and tobacco treatment specialists who can help keep you on track, to always have those go-to tools and that resource that I can revisit at any time. And let's say for some reason I'm successful in quitting and then some unforeseen circumstance has me relapse back into smoking. It's 12 full months, so I can go back into my membership that you provided to me, reset my quit date for a future date, and go back through the sessions and have an even stronger quit attempt. So one membership is not just one quit attempt. It is 1 full year of continuous support. Another great thing to know, so your membership block is good for 2 full years. So, if you purchased 50, you have up to 2 years to distribute those memberships. And even if you distributed that last membership in the last couple months of that 2-year span, that membership is still good for a full 12 months after the initiation date. So you don't have to worry about that expiring. Once that employee initiates it, they have 1 full year. The lung helpline counselors are available to support participants in this program at any time. So the cool thing too is some folks don't want to talk on the phone. Maybe they would rather talk via email or online chat. All 3 of these features are made available through this platform. So at any time while I'm going through that session, if I'm on that break at work and I read through a session and I think, I want to further explore this, I want to talk a little bit deeper about it, I can email, I can click that button to have an online chat directly with that counselor during that session and really get the answers I need on the spot. And of course, StayWell. So our valued partners at StayWell, those that we collaborated with on this project that really lead the way in the platform and the inner workings, they are available, incredibly knowledgeable, and standing by to help resolve any membership concerns you may have, answer any questions about the corporate accounts, and just provide ongoing support. So not only is the smoker never alone because you gave them this program, you as the corporate purchaser and as the benefit coordinator are also never alone. We're always here to help. So pricing, it's great. This is a great program. Well, how much does it cost, right? So this is always a big question. In comparison, an absolute bargain when we're looking at that $5,816 that businesses can save each year by an individual not smoking, not to mention a full 12 months of continuous support. But an individual membership cost is $99.95. However, I will say volume discounts are available for corporate purchasers of those individuals looking to buy 10 or more memberships. So if you're really thinking over the next 2-year period of time you're going to be using 10 or more memberships with your staff, you will benefit from a discounted rate. And of course, those volume discounts happen in different sections of bulk. So, the more you purchase, the further down that cost goes. So just a really great bargain. I can't even imagine for a full year of support a program that basically runs itself, that has a tracking system and gives immediate, results. I've seen so much success through Freedom from Smoking in my last 14 years of implementing this program, and I'm just really excited to be able to connect with you all today to talk a little bit more about a program I have so much passion for. So with that, I know I covered a lot of information. I'm going to turn it over to John.
Hey, thank you so much, Jennifer. I told you she was the real deal, right? And she is. So you can hear the passion in Jennifer's voice about this program. And who better to talk about it than somebody who is a former tobacco user, right? I mean, so she's coming at it from both angles of someone with all of the clinical experience that she has, but also from her own personal lifestyle. So I really appreciate that. A couple of things. We do have a few minutes to answer some questions that some of you have submitted, so thank you for that. But I do, before I forget, because I will forget, when we're all done today's session, there is a survey that will pop up, and if you could just take a second on your way out the door to complete that survey, it really helps us make sure that we're offering information to you that is valuable, that you got value out of today's session, and I hope you did. And then maybe there's some next steps. If you'd like a demo, that we can certainly do that for you as well. I hope you do. I'd love to have you all raise your hand and say, I'd love to have a demo, because it really is a great course to see. So what I'd like to do really quickly is just impose upon Jennifer for a few more minutes of her time, and we'll go over some questions that you had. The first one is, many of our employees can't have internet access at work, which makes sense, because if you're a nurse, you can't necessarily, you really shouldn't be looking at your phone, right? So how will this work for them if I don't have internet access? I'm one of those employees.
Sure, absolutely. Thank you for that question. You know, the great thing about this program is the flexibility. So if I need instant support, let's say on my lunch break, and I don't have internet access at work, you know, if you have your telephone, you can reach out to that lung helpline to provide you with support on the spot. Another thing, too, is the flexibility. This isn't something that needs to be done during work hours. It's as simple as, you know, accessing it on your mobile phone, your iPad, you know, from home at your leisure, whenever it works for you. So it's something that isn't constrained by the work hours specifically. It has a lot of flexibility.
Yes, I agree. I like that answer, and that's a great question. Thanks for asking that. Someone else has asked about the use of e-cigarettes or other types of tobacco, and will freedom from smoking help in these instances as well?
Another great question. So I can say over the years I have been very successful in implementing this program, both with smokeless tobacco users, pipe, cigar, as well as vaping and electronic nicotine delivery systems. The fact of the matter is, it is based on the addiction model, and as you know, all of these products contain nicotine and also include the behavioral hand-to-mouth oral fixation component, as well as just smoking patterns and routines, or vaping patterns and routines, chewing patterns and routines. The addiction-based model applies to all. So yes, absolutely, this program can reach the masses.
That's terrific, because you really do see that so much these days. So it's nice to know that this course really can address so many needs. Boy, somebody dove deep into this one. Should we be monitoring CO in participants? That's a fantastic question. I'm intrigued.
Oh, yeah. So this is a component, you know, I can definitely tell this is a medical-based audience for that question, and thank you so much for that. With freedom from smoking, we have seen tremendous benefit in monitoring carbon monoxide among participants, and we have had some corporations that, in addition to this program, do have a CO monitor that they implement and have, you know, check-ins with their employees to really gauge their carbon monoxide. This not only is beneficial for you to know whether or not they truly are quitting, but in fact a huge motivator for the user themselves. I remember I was also in the healthcare system, so I had a CO monitor that I took into my freedom from smoking classes consistently and found huge benefit in implementing it, because a lot of folks may not realize the instant impact that tobacco use is having on them, but then also the huge benefit they can experience immediately after quitting. I mean, just within hours, you can watch that percentage of carbon monoxide go down when using that monitor. I would have some patients rush in so excited to blow into my CO monitor to see how they've reduced, you know, from that, you know, 5% carbon monoxide, which again is, you know, 2.5% less than the tailpipe of my Jeep, you know, so watching that change down to less than, you know, that 1%, what a huge improvement. So very cool. If you have the technology, I would fully support you in making it a component.
That's amazing. That's a fascinating question. Hey, there's one that I'm going to handle because it's more on the StayWell side of the house. Can the number of memberships change after you select a block of memberships, or can you change those at any time, or are you locked in? So you heard Jen say, hey, it makes sense if you look ahead and think, I'm going to need over the next 2 years, I believe, based on the number of smokers I have in my facility, I'm going to say maybe 25, right? I'm just throwing a number out there. Once you select that, those are purchased. You're good to go. You can't undo that. Unfortunately, once you buy the 25, you purchase those memberships. However, if you buy 10 and then you decide, gosh, this is really taking off, and people who work here who are smokers are talking to each other about how great this is, and now I've got more people asking for memberships, can I get them? You absolutely can do that, and you can keep that same URL that Jen pointed out to you that, hey, here's your URL, that's yours alone. It's kind of like, think about it like a gift card that you could reload, like one of the reloadable gift cards. You can actually do that here in this case too, so you don't have to juggle different URLs for different people when they came in. Another great one that I can answer quickly is there literature or materials available for employees? So, yeah, so what the great thing about working with the Lung Association is that we've both created pieces and parts to support freedom from smoking. So between us, if you decide, yes, this is for me, and you purchase some memberships, we can give you some tools that you can help to outreach to those folks. So different resources and tools that you can help get out to your employees to drive participation. Well, I think there was a question about, my last question I see here is discounts. There are discounts. The volume discounts are the ones that are available. And again, it starts at 10 memberships and then it goes up accordingly. So if you buy many of them, then the more you buy, the more you save, kind of thing. And I have one last question for Jen in our last minute. And someone said, I don't know, congratulations, Jen, for becoming a non-smoker. In my part of the country, there's lots of people who smoke. I'm not sure everyone will be so supportive. How can we help? How do we help that person who really is about to start their journey?
Oh my goodness, what a great question, and thank you for your passion for wanting to support individuals in leading tobacco-free lifestyles. It is tough. With the right plan in place and the right support system, you absolutely can do it. So my recommendation would be just to be that cheerleader for them, be positive, reinforce to them that everyone can quit and they can be successful. And also just give them the confidence in knowing that they truly are the expert of their own quit journey. So with the right plan in place and in tandem with medication and that you're there to support them, they will succeed. And there's a lot of other support systems that are in place to let them know as well that there's tons of support through Lung Helpline and the online community, but just being that cheerleader, being that positive role model to let them know that they can do this and reminding them that they truly are the expert can mean all the difference in the world.
What a great answer. I so appreciate your time today, Jen. I appreciate your partnership with, and StayWell loves the American Lung Association and is always so supportive of you, so we really appreciate you joining us today. And thank you to everyone who took time from your busy day to join us. I'm just thrilled you're here. And please go fill out that survey on your way out the door. Thank you so much. Have a great rest of the day.